The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. I'm Lauren Riley, Account Executive at Priority Consult, and I will be facilitating the webinar today. I would like to start off by thanking everyone for joining today and being part of our Oncology OnTrack webinar series. Today's topic, we will be covering writing grants to support a nurse navigation program. If you're interested in joining our future Oncology OnTrack webinars, our next one will be on Wednesday, May 8th at 3 p.m. Eastern Time Zone, discussing high-risk oncology programs. The speaker will be Cam Teams, owner of Practice Advantage. To register, you'll need to go to our website. Today's speaker will be Rachel Bachman, Nurse Navigator at Bethesda North Hospital here in Cincinnati, Ohio. A little background on Rachel. She has been more than 13 years, or had more than 13 years of resource development experience, including for-profit, nonprofit, and government-funded grants. She has been the recipient of competitive funding from NIOSH and the Occupational Nurse Association. Rachel has also been the recipient of small business startup grants, several grants for qualitative research studies for health and human service agencies, and grant for new program development. For the past 12 years, she has worked as an oncology nurse. Rachel, you can go ahead and get started.
Okay, what I am going to do today is give an overview on the basics of writing grants using examples from several Nurse Navigator programs and services. Today, I will not be covering federal grants. These would be things such as NIH grants, R01s, or T32s. Questions that may be of interest to you in that area of federal granting certainly could be emailed to me following the program today. This presentation will review the tips and resources of successful grant writing. We are going to practice interpreting grant guidelines. We're also going to evaluate when to submit or not to submit a proposal for a grant. We'll also review a proposal and its construction and discuss some common reasons for proposal rejection. Grants need to really empower others to become positive change agents in long-term improvement of breast health, navigation, even cancer treatment today. It's one thing I always say, to provide early education and increase awareness in areas of like breast health and cancer care. But when you have adults with breast health issues encouraging other adults to make good choices and good decisions, now you're taking real power and talking about real power. I often say to people that are writing grants, if you can see it, if you can believe it, funding can help build it. So let's just, for definition purposes, define what a grant is. Grants are funds or dollars from a federal or state or a private source for a specific purpose. They're often competitive in nature, so it requires submitting a proposal to receive those funds. Okay, then you might ask, well, what is a proposal? The proposal is just an organization or an institution's offer of contract to perform certain services for which the organization or institution, these are known as grantors, will provide the funding or the monies. Let's discuss some of the parts of a proposal specifically. Your proposal, you want to be clear in stating what your program or service really proposes to do. An example might be in the area of navigation where I primarily work, developing, for example, a cost-effective navigation intervention program for a particular high-risk population. With your proposal, you want to show how that project will advance the institution or the grantor's own purpose. An example would be maybe National Cancer Institute's NCI wishes to reduce health disparities. So this is an effort that will advance NCI's purpose as well as the purpose of my navigation program with this proposal. It's really important when you're writing your proposal, and I'm going to say this a few times throughout the presentation today, to follow the application directions exactly. I know from experience, having not followed them early on in my grant writing history, and being rejected because of that. Also in your proposal, you want to demonstrate your project's uniqueness. So I often say to people, set yourself apart from the other applicants that are submitting their request, and ask yourself the question, why would someone want to fund this particular research grant or this proposal? Your uniqueness addresses really important things. It has to do with your project working with people that you will be helping, not to people. So participants must really regard the project on your team as being valuable. You need to show in your proposal what I call an investment in the project. One of the most precious resources for any organization are funds and manpower. And an organization that's willing to dedicate these to the proposed project signals a legitimate project to a reviewer that's looking at your proposal. The other important piece that I like to mention at this point in the presentation is plan for sustainability. And what I mean by that is reassure the funder that your group will continue to support and build upon the proposed project so that the project does not die once the funding is discontinued. We often refer to this as seed money, S-E-E-D. And what that means is that we should plant our seeds and kind of nurture them so that they can eventually survive without us. So projects that only live if grant money is continually provided are not likely projects that the community wants or typically needs when we talk about breast care or navigation services. So if you demonstrate your project's uniqueness and you convince the grantor that your program and its personnel are capable of carrying out the project, you're going to be much more successful. Okay, the big question now is, do you submit or not submit? That's kind of the question. So what are the odds of being funded? 25% of all new grants are typically funded today. 50% of competitive grants are funded. If you're new at submitting grants, I would highly recommend that you look at possibly submitting your first grant in the competitive area simply because there's an increased chance of being awarded your grant. Myself personally, I've been involved in writing grants for a number of years. And when I began writing grants, I was lucky if I maybe had 15% of my grants that would be awarded. At this point, I'm now seeing 48 to 50% of my grants being awarded, so I'm very happy with that. Does the project fit the mission? Again, when you're thinking about a project maybe for your own nurse navigation program or a nurse navigation service for your community, you might look at maybe aligning with a partner. Maybe it is the National Cancer Institute, and one of the missions that NCI has is like to improve the culture of science, which reflects a commitment to collaboration. So do you have the correct grant program to meet your needs and your project idea? Do you have the expertise and the right partners? In our breast center, we are currently looking at a new research project where we're going to look at 2 different anesthetic agents and patients' report of pain intensity following ultrasound core biopsies. So key experts that we needed on that research study included a statistician, included a number of radiologists who actually perform the biopsies at our facility, and also our nurse navigators in the breast center, as well as our breast ultrasound technologist. The other important thing to think about is, do you have support for the project? Is there leadership support? And you want to highlight the potential broader impact of your research project when you're writing a proposal. Ideally, the project would have the power to change public awareness, maybe public policy, transform major systems. But even if your vision's not this large, the project should still have the potential to work in more than one place for more than a few people. So I often share this little tip that when you describe a program for change, you don't want to list all of the desires or wants that you have in your proposal. You want to have instead a detailed plan that describes exactly where you want to go with your project. Do you have a champion or someone that can direct the project? This is important. Some people in their organizations, my organization, for example, where I work, we actually have our own research institute. So we have available to us grant coordinators. So if you have an opportunity to work with a grant coordinator or to sit and observe if you're a new person writing grants, that would be a very good experience, and to use that grant coordinator for your proposal. Do you have the resources to write the proposal? This is important because I know for myself as a nurse navigator, I actually have to schedule time within my day because of the number of tasks and responsibilities that I have to actually schedule time to write those proposals. So I would encourage that when you're looking at writing a proposal for the first time, just include it in your time of your workday. And then finally, do you have the office space and the resources for consenting your participants? That's important. I know at our breast center, we have a large waiting area where our patients come in and register. That's really not the appropriate place to consent patients who want to voluntarily participate in our research study, for example, with the ultrasound core biopsies that we're looking at just starting. So we've chosen to consent those patients in our examining clinical rooms instead. Okay, so let's go for it here. Let's talk about briefly just what is a proposal, how is it constructed. I refer to this as kind of the boring but necessary stuff. The proposal usually contains an abstract and a summary. And what this is really it's your ability to clearly summarize your request, what it is that you desire. The example that we're using at the breast center where we're comparing long-acting and short-acting anesthetic agents as a tool to improve pain management for our post-ultrasound biopsy patients, we wanted to evaluate the potential role of long-acting medication in providing some extended period of pain relief for patients that are undergoing ultrasound core biopsies. So that was kind of our summary statement. Our problem statement, which came out of a needs assessment that we were able to do, looked at somewhat the literature, but also looked at our patient population and what were the common complaints following an ultrasound core biopsy with our patient population. And we had some patients that were reporting, pain, 10 hours after having the biopsy. So we looked and found several radiology review articles that discuss kind of the use of anesthetics for breast biopsy procedures. But our literature search failed to uncover any articles that addressed the additional use of long-acting anesthetic agents for extended post-procedure pain relief. So in our proposal, we believe that the study would serve as a landmark tool for highlighting the benefits of long-acting anesthetic use for pain relief after ultrasound-guided core biopsies for our patient population. Your goal and objectives, this is simply establishing the benefits of funding. And these are objectives that are often written in measurable terms. And we're going to come to a slide a little bit later in the presentation that will actually give you examples of what objectives and measurable language that you can use when writing those objectives. Your plan of operation and your methodology, this simply describes the activities that you want to undertake. This would include such things like as describe your participants. Are they going to be like from age 18 to 90? How will your participants for your study be recruited? What's the number of patients that you need to participate in this study? And how are you going to assign them, for example, to maybe like a treatment group? So that's part of the proposal construction. The other piece of the proposal construction looks at some of your key personnel. You want to demonstrate to your application reviewer or the reader that you're capable of doing what you propose to do. No longer is there degree bias. And degree bias, what I mean is no longer are grants awarded to just PhDs and MDs. Grants are very much being awarded for nurses and other healthcare professionals across the healthcare continuum today. When you look at the evaluation portion of the proposal, this is where you're going to present your plan to determine the degree to which your objectives that you wrote have met or have been followed. The evaluation, I always say don't be too overzealous in writing those in your proposal. The evaluation sometimes can be simply explained with your statistical analysis. So things like, you know, the demographic statistics sometimes are stratified by the age or the anesthetic type, maybe for the example that I used earlier. We might use some statistical tests, such as, you know, like the Wilcox rank sums test or just a logistic regression model to determine if those objectives have been met. Your budget is the other piece of your proposal. The budget explains the costs that you're going to associate with your project being implemented. And you want to carefully separate the cost to be provided by the funding source and by you, the applicant. If you're not clear what your cost may be, it's okay to write in your proposal that the costs are being discussed at this time, and an update will be given at the time, perhaps at your administrative review. Okay, so we're going to talk a little bit more detail about each piece of the components of a proposal. So let's talk a little bit more about the abstract and the summary. I often recommend writing that last. And why do I recommend that? Because you want to summarize all of that important information from your proposal. Things like who's going to conduct the research, what participants are going to participate, where are you going to conduct your consenting of patients, why are you researching this particular question or this topic, you know, how much time will it take. In the ultrasound core biopsy study that we're implementing, we're going to be looking at probably 200 participants over the course of a 6-month period of time. You want most reviewers to read your abstract and summary. In fact, my experience has been that most reviewers tend to read the abstract and summary and only this. So first impressions are truly important. I wouldn't recommend using medical jargon. I would keep things very in layman's terms, not using any jargon at all. And in your proposal, create or convey some sort of enthusiasm with your project. Okay, let's talk a little bit about the problem statement or your needs assessment. Here's where in the proposal you want to identify your needs. What's most important and significant? An example that I would use from a breast care community awareness campaign that we were funded for a $23,000 amount last year. We looked at our needs of our patient population, and upon diagnosis of breast cancer, our patients needed more information and resources, as well as some comfort items. What we do as navigators is we follow up with all patients on a routine basis 1 year after their diagnosis. So oftentimes these resources and comfort items give them hope as they struggle on their journey to survivorship. So what we have been assessing with these patients is the impact of that information and those comfort items that are provided at the time of our follow-up calls to evaluate what our efforts have been. The why is this section of the proposal that is also important, because you want to decide if you should be funded or not. And I mentioned that already in the presentation today, but I really want to focus on that as well as following the application guidelines, because those are probably the 2 top reasons why proposals are oftentimes rejected. Be specific. Don't make the reader of your proposal guess at what you're trying to say. You don't want them to assume anything. So use statistics, cite examples, relate how their mission will coincide with your mission for the purposes of your grant or your proposal. Let's take a look at a couple of objectives. I mentioned earlier that it's important to write measurable objectives. And in our next slide, we're going to give you a list of what some of those objectives and language can be used that will be really powerful for your written proposals. The first example is just an objective that looks at a process. So this example, we had 100 of our stage 1 and stage 2 breast cancer patients that were recruited, selected, and assessed to participate in what we called our entry-level cancer wellness exercise program by November of each year. Of that number, 50 of those would be stage 2 breast cancers, and 25 participants would be stage 1 breast cancers, along with 25 participants that would be recurrent breast cancer patients. Half, or 50 of those patient participants, would come from 3 of our high-risk counties. Our second example is an example of a measurable objective from an outcome perspective. At least 50% of the 100 breast cancer participants will receive treatment in an identified breast cancer center from 2013 to 2015. At least 25% of all those breast cancer participants will have completed a 6-week cancer wellness exercise program, and at least 10% of those will return to the intermediate level of cancer wellness exercise program. So those are 2 examples of writing objectives that are measurable. It's not just what you say, but it's how you say it, I often indicate. This is a list of what I call powerful, energetic action verbs that you want to use in your proposal. The 3 that I have highlighted here in red font color are those that we used in the previous slide example. When you write your proposal, you want to avoid passive verbs. Was and where, they tend to hide the agent of action, I call it. You want to avoid static verbs because they lack movement. Example would be am, is, had, have, do, does, should, would. You want to replace overused verbs such as get, went, put with more active verbs from the list that we have provided here today. You want to use also declarative rather than conditional verbs. So avoid words such as if, could, might. Instead, you want to really boldly declare that the gift will create a positive outcome. So condense your proposal language with detailed language. Let the details convey the project's worthiness rather than depending on a lot of empty adjectives when you're writing your proposal. Also, I recommend to avoid dwelling on problems. Having been a reviewer of some proposals in the last couple of years, oftentimes I'll read a proposal and the person will go on and on about the challenges that they have to overcome and things that just aren't surmountable. So I usually recommend focusing on opportunities that result from the challenges that your organization or your program faces. We did a community awareness campaign at the breast center where I work at in our navigation program, and what we chose to do was invite many more community events. That was our goal, to be invited to more community events through our community awareness campaign, since we would be providing valuable information to all the participants. And we thought this would really help to raise the reputation and the marketability and the image within our community. Okay, we're going to talk a little bit about the plan, also known as the methodology. You want to, in your plan, which is kind of the meat of your proposal, describe the activities to be undertaken and how you're going to do that. An example, again, would be from our community awareness campaign that we were awarded for last year. In that community awareness item, we decided that we would be branded with the breast center's name and telephone number, and this was in an effort to attract additional patients into our breast center for annual mammograms, for example. Of course, this is kind of a revenue-producing venture for the breast center, so at previous community events, there was a clear interest in women following up by calling the breast center to schedule a mammogram. So that was our plan and how we went about describing that in our proposal. You want your plan to always flow directly with the needs, the goals, and the objectives that you've written. Also, you want to describe your staffing and the sequence of events that your proposal or plan will take. An example of this would be we implemented a research project, again, at the Breast Center on the role of the breast navigator in perioperative lymphedema measurements. And what we did in describing our sequence of activities is we used charts and tables and timelines written in our proposal. An example would be the number of months that we thought we would need to enroll subjects into our study. And we thought our pre-data collection would take probably 1 to 2 months. The startup for our research study we anticipated would take 2 months to introduce the study to our physicians, our multidisciplinary team members, our nurses, unit coordinators. And then the time for our data collection and subject recruitment would be anywhere from 3 to 6 months. So you can implement charts and tables and timelines right into your plan within your written proposal. This is usually worth most of the points and probably the largest section of the grant that you're going to write. I'm going to talk a little bit more about key personnel and qualifications. When you have staff that are participating on your grant project, you really want them to have qualifications and expertise. One of the qualifications at the facility that I work with is we require all of our delegates or all of our participants on a research study to undergo a training for consenting of subjects. And we use something called CITI training. This is an online 5-hour training session that we're required to complete before the study actually goes to our IRB board. That certification for that CITI training is good for a period of 3 years. What's nice is that when you're working with physicians or radiologists, they also can participate with that consenting online educational training and use that towards their CMEs. So that's a nice plus for some of the medical staff and radiologists we may work with. Other valuable resources that might be available, things that I like to think about are creating partnerships that are mutually beneficial. So think about what resources does your program or does your service already have that you can use for free at no cost. These might be things like meeting or event space. It could be computer access, communication methods such as newsletters or websites. Other good points is you want to, in your proposal, look to see if you can find adults or volunteers to work with you who really do care about being aware of breast health issues. The experience of helping you with this program, these volunteers may be just what some people are looking for, and that does kind of stand out when a reviewer is reading your proposal or application. Partnerships, they do bring a lot of success to your project, so I truly encourage that wholeheartedly when you're writing your proposal. Okay, evaluation. How we know if the project's successful? Well, you want to be able to explain your evaluation criteria and what your plan will be. The example that I gave earlier of our research project titled The Role of the Breast Navigator in Perioperative Lymphedema, one of our main outcomes was to look at the patient's functional assessment of cancer. We wanted to also weigh the patients to see if there was any weight reduction that had an effect on the lymphedema. Also, we wanted to implement a symptom survey to see if their symptomology was better controlled. We also looked at cosmetic results using some survey tools in addition to the lymphedema measurements that we had with patients. So those are some of the main outcomes that we put in our evaluation criteria for that particular research study. What data do you want to collect? When do you want to collect it? And who will collect it? How it will be done? Again, with our lymphedema research study, our data collection really consisted of a report sheet. It was truly an Excel spreadsheet that we created. And what we did is we reviewed it to show cumulative data. So what we developed were volume changes when we have greater than 1 centimeter of a measurement change in that lymphedema patient, and any symptomology. What will you do with the data? Well, usually your data is going to be used as part of the evaluation tool, but what they're specifically asking about in this piece of your proposal that you're writing is, how will the data be disseminated? Are you going to use it to publish a journal article? Will you be using it to make changes in the services or program that currently exist? Okay, next we're going to talk about the budget piece. I'm going to put a little bit of time into the budget because this is oftentimes where people have questions when writing a proposal. Your budget, you want to itemize and account for all of your costs. You want to come from your proposal plan, not just list line item of what you need, but you want some written justification for all of those budget items in your proposal. You also want to be very accurate. Don't overestimate costs or resources that might be needed. And the research projects that I've been involved with at the Breast Center regarding the ultrasound core biopsies and the measurement for our lymphedema registry, we actually, I obtained invoices from some of the vendors that I needed to actually order lymphedema measurement tapes. We also needed to order a couple of tables that were adjustable that we could properly measure patients, upper extremities that did have lymphedema. So those were examples of just going a little bit more, being a little more accurate and getting your invoices that you can submit at the time of your budget proposal. Some allowable expenses, usually educational handouts are typically covered, but you do have to read the application itself because this varies from application to application. Your supplies such as, our lymphedema measuring tapes, we had an invoice that said that they cost $7.89 each, and we were going to order 500 of those. We also needed marking pens. They usually came in 250 pens per box. So we projected how much we would need as far as the marking pens. And then, of course, the adjustable tilting top tables to do the measurements accurately. So we were able then to submit those invoices with that very detailed budget for our lymphedema project that we had requested funding for. Okay, so we've talked a lot of details about the proposal, how to write a proposal. So now I thought it would be nice to take an opportunity to look at a request for a proposal. This is an example from Susan G. Komen, their Atlanta location. And here you can see on this slide that they have announced that grant applications were being accepted in 2 areas of focus, breast health and breast cancer screening and diagnostic services. What's important with this slide that I wanted to highlight is their mission. Their mission is clearly stated with their request for the proposal, with their announcement, and that's to enable women to detect and survive breast cancer. So if their mission coincides with the mission of your services or your program, that's the piece that you want to incorporate in writing your proposal. In this next slide, you can see that Susan G. Komen in Atlanta was offering grants up to $150,000 for an innovative, not duplicate, project in the area of breast health, breast cancer screening, and diagnostic services. They do specify in their application that the project should target services that are not otherwise available to the medically underserved in certain populations or counties in the Atlanta area. So they've actually listed the counties there. The grants are available for up to 1 year. Komen Atlanta will host 2 grant writing workshops. Boy, this is wonderful. If you have an opportunity to participate in a grant writing workshop, I strongly recommend attending one. Very valuable. I've attended them regularly. Sometimes they're, for me, still after a number of years of writing grants, I attend them just as a good review course for myself. And then finally on the application that they have submitted for proposals, they'll indicate the application deadline and when that application has to be received, usually with a date and time. Okay, and Komen's sample here that we're looking at, their statement of need highlights areas that they're going to fund for that grant cycle year. So for 2012 to 2013, their grant cycle, they're specifically going to look at programs that increase access to and improve affordability of screening and diagnostic procedures for the medically underserved populations. They're also going to look at programs that incorporate evidence-based breast cancer strategies within their standards of practice. That's a really good one. The programs that are both culturally competent and diverse, that aim to eliminate cultural barriers that would prevent women from receiving information or accessing breast health services, is another highlighted area in their application. And finally, they're looking at programs that would ensure the availability of breast health services in a 10-county service area with a priority in counties that had the highest mortality rates. So this is a good example, I thought, to present with today's presentation, looking at an example. Okay, so I always say dream big. Again, as I mentioned at the beginning of the presentation, you know, if you can see it and believe it, funding can certainly build it. So this is your opportunity to kind of think big. So going back to what does Komen Atlanta fund, they are pretty specific in their request for proposal for that grant year that they're going to fund for 2 areas, screening and diagnostic services, and again, education, navigation, and support. But they do specify, if you read their application carefully, that priority would be given to screening and diagnostic grant request. All right, so there are 2 types of community grants that Komen and Atlanta currently offering, and this is the dollars or monies that will be given to each proposal. In the education, navigation, and support area, they're going to limit their funding to $50,000. And in the screening diagnostic area, they're going to limit that, with some exceptions that are noted in their application, to $150,000. If you're looking at genetic counseling or testing of applicants, they have set a limit here of $75,000. So that's important information just to review before you decide what grant is going to work best with your program or service that you're interested in. Okay, so let's talk a little bit about preparing your application and how you want to get started. Komen, again, this is an example from Komen's Atlanta office. Komen requires that their applicants use a cover page, and some of the key points for preparing a strong application, I think, are always to submit a clear, realistic application. You also want to submit a complete application and follow the grant guidelines closely. I've said it again, you want to follow the grant guidelines closely. When you get started, you want to prepare the application using the correct type of grant. I don't know if some of you that are listening today have tried to download sometimes these online proposals, but oftentimes what I find when I'm experiencing that I'm usually, you know, needing to get it done like by 4 o'clock the next day, is that suddenly my computer will freeze. And that sometimes is because, especially at the federal level, if you're applying for a federal grant, they don't always have Mac or Office compatibility. So a recommendation that I would be able to pass on to everyone is to actually use your word processor and just cut and paste the different sections of your proposal, and then just, you know, paste those into the online application. That will save you a lot of time and frustration. Also, when you're getting started, you want to review all the information in the guidelines or on the website. Think about when you're writing your proposal, think about how you're going to develop it. What's your concept going to be? You want to prepare the grant application in a way that you develop a concept for your project. You know, and again, the important questions are, you know, how does the project fit with the mission and the funding priorities, for example, of Komen in Atlanta? And, you know, is it in line with the application that your organization's mission supports? The other piece to this is looking at what Komen defines as their financial information and their personnel. And for Komen, in this example that we're looking at, they define some indirect cost. If applicable, it usually should be no more than like 7.5% of your direct cost. This gets a little bit tedious. So sometimes when you have that grant coordinator, they can help you with this when you're preparing your budget. But equipment cost, sometimes they'll specify, as in this example with Komen, they will specify, for example, not to exceed $2,000 for equipment cost, because the equipment must directly be necessary for the implementation of the project, typically. Salaries is often a question. Can you put salaries into your budget? If requested, salaries typically must be for the personnel that are directly associated with the project for which the grant's being requested. They will not pay for personnel who perform the general work of the organization. And again, your request for salaries usually has to be pretty reasonable in nature. Personnel, this is not uncommon. Sometimes your grantor would like you to insert an employment history or kind of a biographical sketch of the individuals that are going to be involved in your research proposal or your project. In particular, the CV or resume of your project director or your principal investigator is usually requested. And oftentimes, as in this example with Komen, they specify that they do not want that information for each personnel listed to be more than 2 pages per person. Okay, so let's talk a little bit about what's the typical review process. And every organization and institution is somewhat different, but generally they will follow, if not 1 or 2 of these type of review processes, some of them may follow all of them. Again, this is an example that we're using from Komen in Atlanta. So Komen uses all of these review processes. The first one is the compliance review. All the applicants are usually pre-screened by the grants manager to pretty much ensure that the required components have all been submitted. That's why it's so important to follow the guidelines of your proposal as they're written. The community review panel, they're an independent group of community members that are typically invited by, for example, Komen of Atlanta, to review and score all their incoming grant applications. And I want to make a note here. Usually at this point in the review process, each community review panel member is required to sign a confidentiality agreement and to disclose all potential conflicts of interest. I think that's important to know. The grants committee is composed of typically an executive director, the grants manager, and members of the board of directors of Komen Atlanta. This committee accepts the community review panel scoring and makes the final decision on funding recommendations to Komen's board of directors for final approval. The Komen board of directors, after they receive the recommendations of the grant committee, the Komen Atlanta board of directors approves or rejects the grants. Now, your grant can be approved versus funded. And what does that really mean? Approved grants are those the community review panel has voted to recommend for funding, but it does not guarantee that the grant will be funded. Funded grants, on the other hand, have been both approved by the community review panel and favorably voted on for funding by the board of directors. So that is the difference between an approved and a funded grant award. And then finally, in this review process, there'll be an announcement of the grants that have been awarded. And they usually will indicate that to the project directors and how they'll be notified, and in writing in this example that we have here, and by what date they'll receive that in writing award. Okay, so what's in it for us, those of us that are writing these proposals? Really, there's a lot of rewards. I always say there's a legacy of kind of serving our community. There's a lot of success in marketing our services and our navigation programs and our campaigns. Helping others and just improving outcomes of our cancer patients is huge. And then sometimes, we also have the ability to be influencers in creating change. So to summarize a little bit here, Again, you want to follow the application's directions, particularly the due dates, the page limits, the number of copies you need, because everything is there that you need to submit a great proposal. And I always include my little top 10 list. If you look at this as kind of a stressful time, the key is to minimize your stress. So be organized ahead of time. Give yourself and your team scheduled time to actually write your proposal. If you need some experience, if you're new at writing proposals, a suggestion might be to choose a committee to participate on, or just to go and observe if you don't have time available in your schedule to participate. Be aware that sometimes when you participate on some of these, for example, being a grant reviewer myself, sometimes you have to be aware that you're expected to meet like 3 times a year for some organizations, and it may take 2 weeks to review grants that you might be emailed or submitted to you on a, every 2 weeks. So there's a huge time commitment there. So if you're new to grant writing and you want to just get your feet wet, choose a committee to just go and observe. Also, if you have a mentor in your area, I strongly recommend a mentor for new grant writers that can support you and offer you some direction as well. Talk to your grant staff. They love to talk with you, the individual who's writing your grants or your proposals. They like to know you. They also oftentimes, I have found, are great mentors and resources. Your proposal should read like one person wrote it, even though you have a team of 14 people, as we have many times on the proposals that I presented today from some examples. We easily have anywhere from 12 to 16 people involved on writing many of the grants. Be clear and concise and direct. Use those action verbs when writing your proposal. Keep in mind that the individual that's reading your proposal, the reviewer, they're reading probably hundreds of proposals. So if you can use headings, formatting, bullets, white spaces, anything to make reading easier for your reviewer, I recommend it. Proofread, check for spelling and typo errors, and make sure, have someone that's not familiar with your field of expertise read your proposal and ask them, does it make sense? Is there a flow that's good enough from page 1 all the way to page 50? All right, let's talk a little bit about common reasons for proposals and why they're rejected. I mentioned a couple of times throughout the presentation today that guidelines were not followed exactly. It has been known, in my experience specifically, that there are sometimes review committees that actually will take the time to count the number of spaces and small font sizes that do not meet the guidelines that are written. So don't try to squeeze more information in, because that will be the #1 reason why your proposal is rejected. If the idea is not original is another common proposal rejection that is often received. Also, if your descriptions about your methodology or your evaluation are incomplete or not clear. Inattention to detail, carelessness. This is probably an example that I had just in the past year, where I had an opportunity to write a grant, but my deadline was in 2 hours, so I tried to write a grant within 2 hours. Didn't pay attention to detail, so obviously my grant proposal was rejected. And I have to say that was the only one that was rejected in the past 3 years. So it was a learning experience. Take time to follow these instructions. Costs that are out of proportion with the benefits tend to be another reason. Sometimes there's not enough dollars to go around because some proposals are very highly competitive. There is some variability based on congressional budget that will impact some of this. But I have to say, over the past 5 years, funding has been very good. It's been increasing significantly, so that's very proactive, I think. Be active in your professional societies. They oftentimes will offer different grants if you'd like that experience as well. And then another reason for rejection of proposals is just the deadline hasn't been met, either by the date or the time, typically. Okay, so if you have a proposal that's not been accepted, don't give up. I say contact the reviewers. It's very important that you get their comments. Once you have their comments, you can rework your proposal and certainly resubmit it at the next opportunity. My experience working with the National Institute of Health, they usually have a process that you can apply 3 times a year. The DOD, the Department of Defense, usually has a process of 2 times a year. So be familiar with your institution or your organization as far as the times that are available per year to submit your proposals, in case you are not accepted the first time your proposal is submitted. I've listed on the last slide here sources of grant funding. For those of you that are interested, you're welcome to use some of these. So this concludes the portion of the presentation today.
All right. Thank you so much, Rachel. That was really interesting and very informative. And again, I would like to thank everyone for joining today. And if anyone missed anything, we will be posting today's webinar on our website within the next couple of days. In addition, if you guys have any questions regarding the grant writing for Rachel, please feel free to submit them to us at education@priorityconsult.com. And again, that's education@priorityconsult.com. Thanks and have a wonderful day.